Hello, everyone, and welcome back to another episode of C-STE Corner, where we spotlight and celebrate entrepreneurs, both emerging and established, who are shaping their communities and industries. Want to learn more about us? Be sure to follow us on Instagram at CSUN_entrepreneurship for the latest updates, upcoming events, and behind-the-scenes footage of C-STE team members in action. Today, we're very thrilled to welcome two incredible guests, Dr. and Mrs. King, founders, entrepreneurs, and community leaders whose work has made a lasting impact in the world of healthcare and beyond. Let's dive into their journey and hear just how they built their practice, balanced partnership and purpose, and continue to inspire others through their story. I'm Aliana Joel.
I'm Jacob Plotnikov, and this is C-STE Corner. Okay, so first of all, welcome. Thank you so much for being here. We've been reviewing all of your journey for quite some time now, especially me, considering that we're family. Just a little secret there. So how are you today, first of all?
We're great. How are we?
Very good. Thank you.
Yeah.
Always have to check in with her.
That's important. You guys have had an incredible journey with your healthcare practice now for 15 years. So how did you guys decide to start your clinic?
Okay. Well, first of all, thank you for the invitation to be here. It's great to be here at CSUN, and my journey really started here. So I'm a Matador. I graduated in 1989. I was in the Department of Molecular Biology. And at that time, things were still not fair with regards to healthcare. Who can get healthcare, who can get quality healthcare, and who could not get quality healthcare. So my ideas about health policy and healthcare equities really started here on this campus. And that was the time I was inspired to try to get my law degree and medical degree. So that's how it first started. So I went from here, I went to the University of Illinois, where I received my medical degree and law degree. Then I went to Boston. So I did my internal medicine residency there. Unfortunately, my sister became ill, so I came back here to Los Angeles. And during that time period, I was at UCLA, and I was doing some postdoctoral fellowships and doing research. I really wasn't going to practice medicine. And around that time period, that's when I met Alejandra. And so Alejandra saw my journey in terms of doing research and publishing, and realized I wasn't as fulfilled or happy as I wanted to be. So she was the one that actually posted and said, well, why don't you start your own clinic? You have these concepts, you have these ideas. And there are things that we wanted to do with regards to like having equitable access to care. And we wanted to create a clinic, even though a lot of people thought we were crazy. A clinic because we wanted to make sure that there was something in the community and something that had community values. And our first logo and mantra was, what, we treat you like family.
We treat you like family.
And that's what we've tried to keep as kind of our North Star. We want to treat people like family. We want to make sure that the community is aware of who we are and that we're here for the community.
Yeah, one of the things that we wanted to make sure is we're in the Crenshaw area, and we wanted to make sure that our patients could find a place that will look and feel like a place in Beverly Hills or other place that it was very hard to find in our community. So we make sure that we had that we had a clinic that it feels like a doctor that had great degrees, that we have beautiful chairs, that you have everything that you need and see in other practices, that you will have it also in this area.
Exactly. And again, just to add too, is that's community 5 minutes from where I grew up, right? So my mom is still there. We wanted to take this quote-unquote Ivy League education and bring it to the community. To let them realize that you don't have to go to Beverly Hills, you don't have to go UCLA, you don't have to go to USC, you can actually get this kind of education and service right here in your community.
No, that's absolutely beautiful, and the fact that it's really centralized around like making it accessible to like any kind of people. You know, it's not just like, oh, if you are in this kind of community, then you're subject to, the kind of community that you're in. But the
Right.
fact that you guys translate that over, I think that's very beautiful.
Thank you. Yeah, again, that's what we've been working hard on. I think that's our goal. So when we hire people also from the community as well too.
Okay.
And we want people to recognize and understand that there's lots of things that we don't tolerate within the community. We want to make sure that people feel welcome within the clinic.
Okay.
Right? A lot of time there's racial disparities, gender disparities, based upon racism, discrimination, transphobia, there's xenophobia. We want to make sure that people realize we have zero tolerance for that. Okay? And so we want to make sure our staff members, our team members recognize, again, we want to make, the reason why people don't get care is because of internal, external stigma. And we work very hard to try to reduce that. We're human, people make mistakes.
Right.
But we want people to understand when we interview our team members as well too, we want to recognize that we do not just primary care, but we have a growing and thriving HIV practice, both prevention and treatment. We do gender affirming care. We do medication assisted treatment for individuals who have opioid use disorders. Places and from people that may be highly stigmatized in other places, we want to make sure they understand that they're welcome here in our place.
But our practice has, we have decided not to have a special day for HIV patients or transgender patients. No, it's at the same time in the waiting room you can find grandma that has high blood pressure,
Yeah.
a young person that is having a sore throat, and then you can have somebody that is an HIV patient. There is no discrimination, no difference, and we see it in our patients. They don't see it either. You know, it doesn't matter why you're sitting waiting for the doctor. It's a chronic condition. The doctor will take care of you, and we don't make a specific days or a specific hours for whatever reason
Yeah.
you want to see the doctor.
And that was very important because during my training, sometimes I would see that. I would see their big blazing signs that basically said HIV care, or I would talk to other providers who they have an HIV day. We didn't want to have that because,
Yeah.
again, that leads on to stigma, right? And stigma decreases the healthcare access and ability to adhere to medication regimens and also to feel comfortable going to the clinic. We wanted people to feel that wanted them to feel proud of the clinic. And we see that right now, right? We see people that come to the clinic and say, this is my doctor. When they see us doing community-based events, they point out, this is my doctor.
Yeah.
And they have a source of pride in the community and also in our clinic.
No, I think that's very beautiful. I mean, for me, a question that I have for you guys is, what do you think generated that kind of openness to just a wide variety of people compared to other places that do have just kind of, okay, there's these hours for these set of people, there's this for this set of people. So
Right.
what basically like inspired that? Or how did you guys get to that kind of mindset, or how did you even get to that point where you're like, okay, this is open for everybody?
I think it's because we truly believe that equality. We truly, I mean, we're a biracial family. Our kids are biracial. We speak both languages. So we're truly
One of us speaks both languages.
the kids.
One of us struggles.
The kids are fluent in both languages. We are truly believers of equality, and we truly believe that we can be happy and we can have equality. It doesn't matter that we think different or pray different or look different. So that's when we open the clinic, we want to reflect that. We want to say, because you look different, or because you have high blood pressure, your sugars are high, or you have HIV, it doesn't make any difference. We're still humans. We still need a care of a doctor, and we can do this together. So that's one of the reasons.
Yeah, it was a journey, because if I had gone directly from residency to try to open up the clinic, probably wouldn't be as open as we are right now. Right? It took the molding and working in an academic medical center, working in FQHCs, seeing how different forms of healthcare were distributed with regards to the clinic, and realizing that I wanted to try something different. right? It also took someone like a partner like Alejandra to realize that, okay, let's take that risk. Let's do this. Because we could have just done the straight bread and butter approach in terms of healthcare. May probably be more financially viable that way as well too, because we make a lot of decisions with that North Star of trying to provide, keeping people as family that are maybe not great business decisions, but I think in terms of internally and ethically, it feels great to us.
Okay. I think that's a very important thing, especially for entrepreneurs that are watching this, that sometimes the more, financially, the better decision might be the financial one, but your North Star, as Dr. King says, is what should guide you at the end of the day, or else if you have no morals, if you have no ethics, it will all collapse. Now, I'm really interested about the early days of your practice.
Sure.
Because you guys worked together over there, and you said that Alejandra really was a guiding force for you to start that practice. So how were those early days? What was the first step that you guys took to make that possible?
You want to take it out?
No, go ahead.
Okay. I just want to make sure that you're included as
I'm
well too.
included.
So Alejandra slowly started working together because I was doing research and I was working on a topic with regards to monolingual Spanish speakers and particularly with regards to HIV individuals. So we're looking about monolingual Spanish speakers who were men, who have sex with men, but also had sex with women. And then we're looking at third partners as well. And so Alejandra translated it. She made sure the materials were appropriate and linguistically correct. So we started doing research. And then from there, this kind of morphed into wanting to do the clinic. And so I was working, this is our baby. So while this baby was being developed and started to come together, I was working other jobs. I had to work 2 or 3 other jobs to try to funnel money into the clinic. We didn't have computers, so we were doing everything from a phone, from a smartphone. And we thought that because of the work that I was doing, because I was known in the community, we opened the door and people just run in. That didn't happen because we didn't know about insurances, credentialing, and all these other things that we had to learn about.
So we did work probably 4 months before opening the doors on doing credentialings for some insurances. We were not even aware of how much work was that, the behind the scenes of having all the permits and everything that you need. When we opened the clinic, we didn't have patients, and we were very excited. We opened the doors, and we're like, oh, we have tables, we have chairs, we have one computer, phones, and then it's like, and now what? But we did have something that was amazing. That was a good product. That we knew that we had a great doctor. I knew that as an office manager, I knew I had a great doctor. And I knew that as soon as people figured out that we had a great doctor in the house, it was going to be a success. So what we did is we started with 2 patients, and those 2 patients went and told their family, hey, there is a new doctor around the block, and he's amazing. He has this wonderful education, and he is here in the community. So they called their family, and the family called their friends, and their friends start calling everybody. So it was really organic how it grew. It was not, we didn't do a lot of, we were thinking, okay, we maybe need to do a lot of marketing and all that, and we didn't have to because unfortunately is in the area that we are, we don't have that many doctors. It's not that many practices open, so organically went to the community like, hey, there's a doctor.
In the beginning, there weren't a lot of practices there.
Yeah.
Now people are staking their claims, all the big corporations that are coming around the area. But 2 other things here was location, right? So the location that we were located, my pediatrician when I was a kid was about 5 minutes away. So in this big area. So I think a lot of African Americans in the Baldwin Hills, Crenshaw, Lemert Park area, they knew growing up this is where the African American doctors were, right? Because a lot of times we were not allowed to go over. to other places, or there weren't other physicians that took us into these areas. So people remember that, and remember going, hey, I remember seeing my pediatrician here. My mom's doctor was here as well too. So that was one thing, the location. The other thing, there was a doctor that retired. He was retiring. He was closing his practice. So unfortunately, he gave all his patients away, but we still had that location, right? And so he wrote letters to let his patients know, but some of them didn't get the message. So some of them just showed up.
Oh, wow.
Just knocked on the door looking for the doctor, and I said, no, we're here. You come on in, and I said, but again, we have to learn about insurances. We have to learn about all the things. But location was very important. A reputation from a prior doctor was very important, and then a lot of it was just word of mouth, just being available.
Yeah.
I'm just astonished because it feels like you guys were able to grow something out of like personal stories, like what you said growing up. It's like you hear people are at this place or they're not allowed at this place, and then that's basically how like you guys came together, and it's really beautiful that you guys found each other. Really. So you built this business together. What have been the advantages and maybe lessons of being both life partners and business partners?
I think it's great to work with your partner if you have a great communication. I think we have established a strong line in between business and not business.
Yeah.
I had it more strong than
Much more.
But so I as a partner, I make that line pretty strong at home. Like, no, I don't. Certain hours I'm not working. I'm the wife. I'm the mom. I'm at home. He can be working, but I'm not going to do that. I'm in my role of being a mom, a wife, all of that. So I think that's important to make these lines of when can we work, boundaries, when we can work together, when we cannot. And I think it's communication also, no?
Yeah, I think that is too. I can do 6-7 days a week of working, right? I can do 15-hour days. I can do all these things, and having our kids made a change in terms of focusing more in terms of family as well too. But I could do that, and the problem is I'll have ideas in the middle of the night. I'm like, hey, what about this and that? And Alejandro will say, come on, because we are together pretty much 7 days a week. We ride to work together. We're around each other a lot. And you're right. I mean, we do have to have boundaries, and Alejandro sets that together and lets me know. My kids let me know as well too that it's time to shut it off as well too. But it's good to have somebody that believes in the risk, because not everybody can believe in the things that we're doing. I mean, it took a tremendous leap of faith for Alejandro to say, okay, let's do this, because I mean, I had steady income, everything's going pretty well, and now I'm just telling you, okay, let's put all that aside and let's open something we don't know how to open. We didn't have people helping us in terms of telling us what to do. We had to learn by books and just by making mistakes and all these things, and not everybody wants to have that journey. And particularly if you think about the stereotype of being a doctor's wife, right? With all the goodies, all the salary, all the things that we took hits. We took financial hits as well too. And so you had to have somebody else willing to take that ride, because again, we had the idea of wanting to improve things for the community. So it took a big leap of faith, and maybe I could think of other partners that would not have wanted to do that.
Alejandra, what was the biggest shock when you started, your journey with at the practice?
I would say, you mean like the hardest
What
part
was
the practice? Probably employees. We had a big dream of helping the community, a big dream of we can make it. We think very similar about that, so it was very easy to keep our goal of we want to help the community. We know what we want, but to have employees that can join us in the same dream, that they have their own, the employees come with their own package and their own life and their own situations, and to adjust to that, to remember that these employees have their own life, they have their own situation, they're having their own problems in their moment, and I have to, as manager, stop and think, okay, it's not just the community, also my employees need that help. I have to extend that to them, and at the same time request them to be working on time. It's a business, I need a job, all of that, but at the same time don't forget everything else that these people are going through. So I would think the hardest part in my part is that relationship with employees. That is sometimes it's hard in when you have your own business, because it's as somebody that you appreciate, that you love, that you want to help, but at the same time they're working for you. So you need to have boundaries, you need the times, all that. So that is probably the hardest for me to learn.
I also wanted to just put in that Alejandra was not trained as an office manager. Her background, her education was an architect, interior design. So for her, again, to completely flip into be an excellent office manager, that other people come to for advice at the office, but that's a testament to her skill. It is a skill to be able to deal with patients and providers and insurance companies and employees, etc. Because it's a completely different skill set than what she was trained in, and she's great at it. It's very good.
Well, I think when you go to college, to university, you get trained for one thing, but that doesn't mean that you are specifically only learning for that. When I was trained to be an architect, I was trained to work on times, and how do I make a construction and a design in certain amount of times, and that helped me a lot with the clinic. I had a job one time in between when I came to United States, and I learned how to do customer service. So there is a lot of things that you learn in between being in college and all these extra jobs that you do in college. Don't take it as, this is just to make a little bit of money and survive. Those jobs are probably the ones that are training you to be successful in whatever you want to do in life. And sometimes you feel like this job doesn't have to do anything. It's not related with what I want to do in my life. Not true. It might be so important. Like I did a job that was customer service, and never ever thought that I was going to do that because I'm an architect. Customer service in architecture is not that common. Right now, everything that I learned in the job, I apply it right now. So it's very important that you learn your lessons in college, even though after college you might move and do something completely different of what you're learning or you're studying. A lot of things you are going to apply in the future.
That's true.
So take it, enjoy it, learn it, and don't never say that one job that you're having is not going to be applicable on other job. And in the future, you never know what is coming. You might learn something that you go like, I don't know why I'm learning this.
There's a reason.
Exactly.
I think that's a great lesson, because it's, that is one of the biggest fears as college students or individuals younger, that we're wasting our time, that what we're doing has no purpose. But I really appreciate you really putting that out there, that you never know, and that each and everything that you encounter, that you these challenges that you face, these boundaries that you break, everything has a sense of purpose. And so whatever it is that you are doing or you are pursuing, keep going.
Yeah, absolutely. I think Jacobo and Alejandra are both astounded by all the jobs I used to tell them about I used to do in college. I worked in lumberyards, I did construction, I did bartending, I worked in the bookstore, the Matador bookstore. I did all kinds. I was a tutor, so all kinds of things. And they all turn into, as you said, what I'm doing now.
Nice. Now we've talked about some of the challenges that you had starting that clinic. What are some of the most rewarding things? Because you've talked that you work for 6 or 7 days a week, or that it's hard to manage. There's a lot of things happening. What is the thing that motivates you? What are those moments that refill your energy?
For me, probably is when I see a patient that goes out and tells me, I have never had a doctor that pays attention to me, or I have been looking to find out what was wrong with me, and now we know. Not necessarily even I got better. It's just somebody hear me, somebody listen to what I have, somebody is paying attention. That's a reward for me to know that I'm helping the community, that we are seeing and hearing people that have not had the opportunity. So that's the reward.
Yeah, for me, there's a couple. I mean, one thing for me is like realizing this is not a dream anymore. This is real, right? I remember I think it was like 6-7 years ago. I was walking out and I was looking at some of our employees, and they had put pictures of their daughters or their kids up and on their workspace, and I said, they're claiming this space. This is not just a dream or a concept that we want to have a clinic. This is really happening. Our practice has grown. We're thriving in terms of providing care for people that are living with HIV. We're providing PrEP as well too, and people are recognizing this as a referral place. I mean, that is great. We've grown from a smartphone to now we're actually having people coming in. We're having medical students and college students rotate into our practice as well. So it's being seen as an entity. And so that is something I think that we, from literally nothing to just opening the door and expecting people to come in, to now we're booked solid for months. Students of all type are coming in, and our patients see us in the community and still say, this is our doctor, this is our team, and they know it. I mean, that keeps me motivated. Because it's tough, because we're living in a world where our ideals and things that we want to happen and accomplish for our community are under threat, under fire every day, right? The destruction that's happening in terms of our healthcare system, are the things that are happening with regards to the patients that we are vested in treating are under fire all the time. It's very frustrating to see that as well. We don't know. I mean, one of the things that happened post-COVID, we were able to establish, because I'm talking about technology, is a telemedicine program, right? Because people were afraid to leave. And so we provided telemedicine. And I think we were one of the pioneers to try to do this. We had a great grant from Healthcare LA Care, and we implemented a telemedicine program that was thriving. And that involved into people starting to do PrEP, which is pre-exposure prophylaxis, which was prevention for HIV. People were sick from the hospital, we were able to see them and not having them come in. And so it's become a thriving part of our practice. Now it's under threat because as of last week, telemedicine is not allowed, right? What's going to happen to Medicaid in terms of our patient population? That affects it. Medicaid is one of the biggest payers in terms of HIV care. We don't know what's going to happen right now because of all these things that are happening under fire. All these racist and transphobic and homophobic terms that are coming out of people who are supposed to lead us. People now don't want to come for care because they're afraid. They're afraid that ICE is going to come to their door, right? Instead of it coming to having care. It shouldn't be that way as well too. So I'm furious every day. And it takes the team in order to try to calm me down. Because every day I'm angry at what's destruction that's happening in our public health infrastructure. And it shouldn't be that way.
I'm wondering, with challenges that have gone in the past and with these challenges, how do you affront these challenges in your practice?
What do you mean?
what are some of the things you set up within your practice to make sure that these challenges don't make your office spiral into...
Yeah.
Yeah.
I don't know how to go. Well, I mean, I think some things are really faith, right? Some things are just good fortune. We've tried to implement things by learning, by doing as well. But we've had mistakes. We've had things happen to us. People have stolen from us and all other kinds of things. We could be making a lot more money than we could be making as well. But I think just the idea of, again, keeping that idea of trying to provide great care, quality care, people feeling comfortable, all these things that we're seeing and materializing, I don't think we've had anything that we couldn't recover from. Right? I mean, we've had challenges, but there's been nothing that we just said, look, we're going to close the door.
No.
Okay, we've overcome all those challenges.
I mean, the health industry is a little bit different than other businesses. Fortunately or unfortunately, people get sick, and it doesn't matter what is the economy or what is going in the country or what is the politics or anything. It doesn't matter anything. People get sick and they need to see a doctor. And so that's why it's a difference in other businesses that people take decisions of, I'm not going to go out to a restaurant because I don't have the money. But if you're sick, you're sick. You need to see a doctor. Even if you don't have insurance. So that makes our business a little bit more comfortable in the situation of, in difficult times, what is going to happen, because people continue coming. We don't see a future where people are going to stop going to the doctors. So it's just being organic on changing insurance contracts, how we're going to see patients. Yes, we have to learn and be aware of that's happening, so I keep myself informed of what's happening and where do we have to go, how demographics are changing, things like that. But the doors are going to be open in between we have a doctor in the house. So
Well, yes. So yes and no. I mean, I definitely hear what you're saying. I think the problem that we're having, there's no other business I think about where somebody automatically says, okay, you're charging X amount for services, right? But we're going to pay you this. That's what happens.
Because you have to deal with insurances as well.
Yeah, that's the insurance part.
Yeah.
Exactly, yeah.
And then they'll say, oh, we paid you too much, so we're going to take back this as well, too.
Wow.
So it's not just the issue of, all right, I'm going to see this patient for $100 or $300 a visit. And then I could say that, I'm going to pay, my services are worth $300 a visit. The insurance company can say, no, I'm only going to pay you $80.
Wow.
Right?
And they can backtrack.
And then they could come back and claw it back later on as well, too.
Oh, okay.
And then they only pay you a certain percentage of that $80 as well on top of that.
Wow.
And so California and some other states are very heavy in terms of what's called capitation. And capital, they're paying per head. So they'll pay you X amount per head, per member per month. All right? And then whether you see that patient one time, 20 times, no times, you just get paid that amount, that one-time amount.
Wow.
So say that could be, for Medicaid, for our population, well, not our population, we could be paid anywhere from $13 to $17, and that's it, for that member.
A month.
A month.
Oh.
And what did we see? We know that Medicaid populations from lots of times, these are sicker patients. They deserve to have more care and more time. And $13? That's why you're not going to see a lot of providers, particularly providers in private practice, taking care of patients, or that are Medicaid patients, or they're taking care of lots of them in order to create this volume that they can try to recoup some money from that as well too.
But then the care
goes down because you don't have time to see them or spend time with them as well. So that's the biggest conundrum as well, is like, how do you provide good care, you're listening to the patients, respecting their wishes, not just necessarily being paternalistic, but realizing that you have a budget of some sort that can fluctuate. because all of a sudden the insurance company may say, no, we're not paying for that anymore.
Yeah. That's,
Like I said, we got a letter just last week that says, no, we are not going to pay for telemedicine visits anymore. So there goes my Monday afternoon and Friday afternoons that we've been building for 3 years.
yeah.
And I don't think of any, I've worked in several other businesses. I don't think there's any business where they claw back like that. So it's hard for us to budget, right?
And that,
I mean, it has the pros and the cons. The pros is we still have people sick. Somehow we have to see it. It's not that we're not have a business to open and have the patient coming in, but then work with the insurances and see how much are they going to pay, can we keep the doors open, all of that. So it's a balance in between one and other one.
Yeah, so it's tough. It's tough to be in private practice and to be in solo practice as well. I think this is why several practices that I know, they're selling their practices to big hospitals and big corporations and becoming employees, because the amount of work that's being required for us to do is difficult to do. As a solo provider, that's why it's so important to rely upon it. You have to have a good team backing you and a good product.
Okay. Well, at the point that you guys are at now, how do you see it evolving in the future?
For me, unfortunately, I think that the writing's on the wall. I do think that we're not going to see solo practices that much anymore. I think hopefully what will happen though is that we have like-minded providers working together in small groups so they can pay with a focus on the patient. But the amount of paperwork that's being required, the amount of things that are being demanded in terms of our time, the return on investment in terms of it's going to be too difficult to do. I was very fortunate in that I was able to get scholarships, I was able to get loan repayments. So my debt was much, even going to 2 professional schools, was much lower than the average person. So I was able to pay off my debt a lot earlier as well too. A lot of people are making decisions because they're faced with a tremendous amount of debt. They can mean several $100,000 in debt, right? I didn't really have that. So I was able to make that decision to do what I want to do. But the financial decisions are going to be really driving that. The other thing I think is what's going to happen is unless we do something with regards to our healthcare system, we're going to be in tremendous trouble, I think, particularly with regards to having small group practices like myself or private practices.
Well, I agree with William on private practice are every time less and less. We see these huge practices and huge groups that are taking care of patients, and we're seeing the more the computerized AI, all of that taking control of a lot of things about our health. But at the same time, I'm a little bit more positive than William. That's why we're great balance. I see that people still try to find that practice, that doctor, that one-on-one relationship. That person that you come to the office and say, hi, Mr., Mrs., instead of number 2562, and they never look at your eyes. I see that in the future might be a little bit difficult and changes are coming, but I think we do have a good amount of people that are looking for what we have as a practice. I always tell that to everybody. Our big difference with Kaiser or UCLA is that we know our patients. When they come in, I sometimes hear my front office saying, oh, hi, how are you, Mrs. Johnson? How's your dog? Because we know that person has a dog, and we know the doggy was sick. And just that makes a whole difference for that human being. That exactly moment where you ask a person something personal, something that you know about that person. How are you feeling today? Are you better from your cold? So I don't think our business as a business is it has an end soon. It might end because we get older. But more than anything, people are looking for that one-on-one, that person that really look at us and knows who we are.
Yeah.
And
because our pages have watched our kids grow up. So when our kids were little babies, we didn't do childcare outside. We did childcare inside the office. So there are times where they'd see me and I'm feeding the baby, or you're feeding the baby, and they'd see the kids grow up.
yes.
And when the kids, get sick or they pretend to be sick, and they stay with us in the office, and the patients know, they ask about the kids. I think that helps as well too.
Yes.
That,
Yes, that's
that,
not going
that,
away.
that endears us to the patients. And it's not, it's not a gimmick. I mean, it's reality. It's something that just organically grew. We didn't think about, I'm gonna use my baby as a prop to. It's because we didn't have childcare, and so we brought them into the office.
No, like I feel like regardless of how the world is evolving in terms of technology, human connection is always very vital. And I think you guys really carry that, and it's really inspiring because you guys are giving life to something that was supposed to have life in the first place.
Yeah, I agree.
And
That's a good
so-
point.
Yeah, so based on this, and just in general, not just as a doctor, but what advice would you give to entrepreneurs that are trying to get into the medical field? In general, not just as a doctor, so if it's a product or anything, what advice would you give them?
When I was pre-med, there was an advisor that I had. Her name was Angelica Braestrup. Oh my God, Louise Howard, Mary Blanding. So there was a program called it's not there anymore, unfortunately. It was the Drew MCAT Prep program, and it was to help us originally to prepare for taking the entry exam to get into medical school. That's what it's supposed to be, but under that was a way of just revitalizing yourself, right? And believing in yourself, because a lot of us are just beaten down. Right? Sometimes being the only person in the class that look like us. And seeing other people that are striving for the same goal. But one of the things she told me too was that every Monday to read the LA Times and read the health section and learning about what you want to do, right? So read what you want to do. And then the other thing you want to do is talk to individuals who are doing what you want to do as well too. If you're interested, if you're inspired by what we're talking about, come to our office and try to see if you want to volunteer. And you may not want to volunteer to be a physician. You may want to volunteer to be an office manager. How do you manage a diverse amount of people with competing needs? To see that, that's a skill. And to learn that as well too. But see and meet with people where you want to be, right? And then don't be discouraged as well too. I remember there was a professor here, I'm not going to mention him.
Say it, that counts.
I think he's still here as well. So basically it was the issue was this, is that they found out that I did well on one examination, and they took me to their office, and he said, "Who are you? What are you doing?" And he said, believe it or not, he said, "No black male's ever done well in my class before."
Wow.
And then I left my book bag one time, and then he wanted to talk to me about interviewing, medical school interviewing. And if he watches this, he knows who he is. And the reason why he'd done it, he had gone inside my book bag and saw that I had entry letters inviting me for medical school.
Wow.
Right? I'm going to my book bag.
He opened it.
Yeah, he opened this stuff, but it just shows that we feel a lot of times that we can't do it, or people who are trying to be discouraging. Now, he may not try to be discouraging. This may have been his way of trying to encourage me, etc. But I didn't feel protected. Right? So don't be discouraged by these things, and then realizing that people are doing what you want to do, and using your community to try to help support you. Because what helped me get through this program and doing molecular biology and revamping my GPA was that program that I talked about. But also the community, there was a committee of us called, it became Minority Achievers in Science. And we were in the basement of the science building. We all worked together, we all studied together, we all collaborated together, and we all commiserated together as well. And that support group, if I had not had that support group with me, I probably wouldn't have achieved what I have achieved at CSUN.
So look for support.
Look for support. Look for people that are looking for you, right? Looking for people that have your back as well too. Looking for people that could, realize if you're hungry, they can give you a sandwich, right? Or if you don't have your rent, you can crash on their couch. Looking for people that support, because it's here. It truly here is in this environment. You just have to be open to it, because this is the starting ground where people start to challenge you and challenge your beliefs and say, no, you can't do that, right? This is where you start to make that stand and say, yes, this is something I want to do. I don't feel that your language, your words, your barriers that you put up would detract me from my goal. But I realized that it took to have an environment like CSUN in order for me to be able to do what I'm doing right now. Yeah. So I expect the CSUN t-shirt.
I think, especially for young population, look around who are you spending your time with. Sometimes you spend time with fun and, of course, college fun and party and all of that is important. I'm not saying don't do it. Do it. Do it the right way, but do it because it's important to do it. Socialize, learn how to socialize, learn how to behave around people, but also look around who are you relating with, because that's reflect who you are in that moment. You want to relate with the ones that inspire you. Those friends that you look at and you say, oh, this person is awesome. I just want to be like that person. That's the friend that you want. Because that's who you become. So always look around to see who is around you. If you have a friend that's always telling you you're not going to be you can't do it, you can't make it, no, that's not. And I'm not saying your friends should lie to you and say, oh yeah, you can do everything you want, but they should cheer for you. And they should be around you and try to cheer and try to give you energy to try to get to that goal. Sometimes friends also have to tell you the truth and say, maybe you should shift that way, but it's always in the positive way. Your friends should be always giving you positive feedback of your dream, not just destroying it. We got a lot of people that tell us, you guys are crazy opening a clinic. You guys are crazy. Healthcare do not need a clinic like yours. And we join forces and we say, no, we are together, we're going to do it. And if it doesn't work, we will figure it out. We will make a plan B. So that's definitely have some partner, have somebody that hold your hand, have a plan B. Life always needs plan B, plan C, plan D. If this doesn't work, what I'm going to do. In between it works, what I'm going to do in between. Like William was saying, he had 2 jobs in between the clinic,
started growing.
It got together. So business don't grow in one day. It takes time, it takes effort, it takes energy. You have to work probably even harder than if you have your own, if you were working for somebody else. So just make sure that you understand that your life, it will be committed to your business. Especially in the beginning. Maybe after you can have a little bit of a break, but in the beginning you have to put a fully time effort on that in that project. So
I can see one thing as well too. So I don't know if anybody that I went to school with is watching this, but at the same time I really am grateful for their friendship and their support over the years. There was one person in particular who I lost contact with. His name was Trinidad Noriega. This guy if it had not been for him, I probably wouldn't be. Because I did not think about some of the classes that he thought were instrumental in terms of being successful in medical school. If I had not met this guy and worked with him and developed a friendship with him, it would not. I doubt it would have happened.
Yeah.
So you have to find that someone that's willing, like you said, that's willing to share with you, that's willing to help you, that's willing to support you.
Yeah.
And it was here. It was here at CSUN.
And there you go. You're at CSUN. There you go.
So it sounds like you guys work really well together and that you find those attributes in each other. What piece of advice do you have to give in terms of like what happens when you don't agree with each other? Or like if there are disagreements or one person is on a different page and what's your advice for that?
When you're married, the woman is always right.
You heard it right there. Patent that is the woman is always right.
No, truly. What do you think?
It takes a lot. It takes a lot. Because, again, if you have a business, and lots of I worry about the business, right? And the business to me is like a third part of the family. And so it's Alejandra that's got to keep me grounded and realize that I can't always talk about business. And realizing this business has allowed us to do things that, if I work in a 9 to 5 at another facility, I may not be able to do it. So I've been able to go to our kids' events and things such as that. But yeah, so when we argue, just like when we argue about things that are not medically related, that we realize that we have to put our relationship first, right? And not to say that we don't argue, because we do. We have argued. We argue because we have our family, we have our kids, and we have the business, we have each other. Others as well too.
Healthy arguments also, because I think in some point it's healthy as a partners in business and as a partners at home. It's healthy. It's healthy that you can talk and you can express who you are and your thoughts.
Right.
What is not healthy is how you are arguing. So that's where you have to work on with your partner. How are you having that conversation? Because it's okay to have different point of views on things. Is how we are going to resolve this issue. So sometimes we just put the whatever we're arguing on the side. Like we're going to just not even talk about these for a while, and we just become partners and go watch a movie, take the kids out, and then we can take that back to the table to see how we're going to resolve the issue. And the same the other way. If we're arguing like husband and wife, we come to the office, that stays in the car. We can't bring it to the office because it's not healthy. It's not okay for us to bring that to the office. So it's just learning that it's okay. For me, it's okay to argue with a person. Is how I'm not going to let this argument not end.
Right. All right, so now before we wrap up, we have a little segment called Agree or Disagree, where we will be saying a statement and you guys will be raising your left hand if you agree.
Okay.
And your right hand if you disagree. Number 1, success comes from taking risks, not playing it safe. Agree. Okay.
I agree.
Yeah.
Self-explanatory?
Pretty much.
Pretty much.
You have to take the risk.
Pretty much. You have to take that risk.
All right. You should never mix business and family. Okay.
I think we're obvious about that.
No.
Yeah.
That's our story. I don't think that we would be 14 years here if we didn't have family as part of this practice.
All right. Work-life balance is a myth. It's all about priorities.
Uh-huh.
I agree.
Work-life balance is a myth. It's all about priorities. Work-life balance is a myth. It's all about priorities.
We'll take it.
Yeah, I'm like this. It's hard because again, I would love to. I think it's a goal to achieve, to try to have that work-life balance. But I think in reality, basically, if I'm the hamster on the wheel, right? So if I stop working, then there's no money coming into the clinic.
Yeah.
So it's hard to have that work-life balance at this stage. No, I don't think at this stage, at this type of business.
For that type of business.
Because I always have to be on until I get a partner or a clinical partner.
I don't think even if you get a partner, you're good to stop.
Oh, I would, believe me now. I would. I mean, if I had somebody to just say, because we can never even take full-on vacations because I'm always on call, and somebody's calling, somebody's sick, somebody needs a medication. So yeah, I would love to have people just completely
But that would
shut
be
off.
with any business. If you're the owner, you are 24 hours.
Yeah.
Somebody has to do the 24 hours. So.
Right. So it's a goal. I mean, definitely want to try. I try to have more of a work-life balance, but I just, it's hard. So that's why I say half.
Yeah, I like that answer.
Okay.
I'll take it.
I'll take it.
Mhm.
How about social media is essential for any modern business? Agreed.
Yeah, we need to learn more. That's why we're working with younger populations. You know, and we realize it's a lot more labor intensive than I thought it was. I mean, I can't do. We tried. I can't keep up with it, and so we're working for individuals to help us. I think it helped to have social media, helped to have good reviews.
Yeah.
Right.
Right, but don't forget that even the social media is very, very important marketing and very important for business.
Yeah.
Your business is more important
Yeah.
than your marketing, and your business is more important than your social media. I think, except if you are a influencer, that's different. But if you are going to have a business, I think some people put so much effort in the social media and in marketing, and then when the people come to get the product, it doesn't match.
Right.
So don't forget the most important part of the
Is
whole
your
thing
business.
is your business.
Yeah, that's a good.
Yeah.
Yeah.
No, that's great. In healthcare, compassion is just as important as skill.
Oh yeah, yeah. I mean, I think that's
Your practice.
Yeah, the
That's-
practice, yes.
I was just gonna say.
Yeah.
You have to fail a few times before you really succeed.
You disagree?
I disagree. You don't need to fail. Some people don't fail. Some people just go step by step and they're steady on going up. Not that I say that if you fail, you're not successful. You have to stand up and go, but you don't have to have a big failure to be, powerful and have a good business.
Yeah. They've always told us that
No.
failure.
I mean,
you know.
I guess it makes you strong on the if something goes wrong, I can stand up and do it again. And yes, it's true. I think if something goes wrong in our business, many days something had to go wrong, and we have to figure it out. But I would not call that a failure.
Yeah.
I would call that more like it was a step to take, because we never close the doors. We never have a completely failure to have a business.
Yeah, we've never closed the doors. Even during COVID, we've never closed the doors. Now, have we? We've had close calls in terms of things. Yeah, we've had close calls. So I wouldn't call those failures. I would call them, stumbles. Yeah, we've had several stumbles over the time period.
So
And personally, I've had to reinvent myself several times as well too. From stumbles as well.
Entrepreneurs are born, not made.
Entrepreneurs are born, not made. I disagree with that.
both.
Yeah. But you're like ham too, bro.
I think both. I think some people some people are born to be entrepreneurs, and some people are made.
Mm-hmm.
So I think you can decide in life what you want to do. Some people have it since they are born.
Like it's just natural.
It's the natural thing. There's the natural seller, the person that since they're very little they can sell anything.
Yeah.
And there's the one that learns, take the books, reads, get the knowledge, and get there.
There you go.
But it helps, I think, also to see it, right? I mean, your dad was an architect. He had his own business. So you saw that. My dad was like a research scientist, an engineer. He worked for companies, etc. So I never saw one of my family members have a business before, their own business.
Yeah.
And my dad remarked, I mean, we're the first person in our families here that have had a business that's been successful. So it's, yeah, I think it's yeah, I guess I could say it's both. But I think you have to see somebody,
Okay.
right,
I like that.
yeah, in order to go forward.
I think it's like a talent. You know, some people are born with a talent,
Yeah.
but if they don't work on that talent, nothing happen. You know, beautiful voice, but if you don't go to classes to make that voice beautiful, you will never be a singer. And some people have to work really hard to get there. And they have to take classes and they have to educate themselves and do a lot of work, but they can get into the same place. So I think it's the same with business, both ways.
Very fair.
Well,
Okay, well, that concludes our segment, Agree or Disagree.
thank you so much for joining us today in another episode of C-STE Corner. If you enjoyed this episode, don't forget there's more episodes in our channel. So go subscribe, follow us also on our Instagram at CSUN_entrepreneurship. And stay tuned for highlights and other things that will help you in your entrepreneurial journey. My name is Jacobo,
My name is Eliana Joel
and thanks for joining us on C-STE Corner.